So real quick, the medical options. Orlistat is the only over-the-counter medication. It's also known by the trade name Xenical. What it does is it binds fat. If you eat fat, gets into your stomach, you take that medicine, gets into your intestines, it binds to it so you can't absorb it. And if you can't absorb it, can you imagine where it goes? All the way through and out. So people with Xenical or Orlistat lose weight usually not because they're eating fatty foods, but because fatty foods make them feel poorly. Abdominal cramping, greasy, smelly diarrhea. I don't have any patients who wanted to take Orlistat. Prescription medications, phentermine is the most common. It's been around since 1959. It's half of what used to be fen-phen. That was a big fad for a while. Very successful with weight loss. Fenfluramine was pulled off the market. Fenfluramine caused pulmonary hypertension and cardiac valve problems. So it got pulled off, but phentermine is still on. But phentermine is amphetamine. That's what it is. That's the chemical structure. If you've ever seen meth addicts, how bad they look, gums, teeth bad, you know what I'm talking about? That's because our bodies quickly become tolerant of amphetamine. So it works for 8 to 12 weeks. If anybody's been on it here, you know. It works for a while and then it stops working. And so the FDA guidelines, you can try it for 3 months, 12 weeks, and then you have to go off of it because it stops working. The reason why meth addicts look so bad is because they have to keep using higher and higher and higher doses of the drug to get the high. So you see all the side effects of high-dose amphetamines. Topamax is an old headache medicine and a seizure medicine, but it just was noted people who were taking had some modest weight loss. I personally, treating a patient with only Topamax, have not had much luck at all. But if you combine these two together, they actually work fairly well. So for years, I've used phentermine, which is half its normal dose, along with Topamax. They're both generic medications and had really good results for some people. Recently, I think it's 2014 or in the 2013, Quasimia was approved. It's just a long-term, slow-release form of phentermine and Topamax. You have to start at the very lowest dose, and then you start to escalate up. For my patients, and it's expensive, by the way, because it's new. So most of my patients are like, man, give me the generic, okay? The regular dose generic, and let's go. Belviq is relatively new. It works on the hypothalamus gland to decrease the sensation of hunger. I haven't had a lot of luck with it. The average weight loss at 12 months with Belviq is about 20 pounds. Most people want to lose more than 20 pounds. The deal is it's new, expensive, you can take it in the long run, okay? But if you go off it, you're gonna regain the weight. If insurance covers it, that's fine. Very few do. If not, it's about $150 to $250 a month, depending on whether you get a rebate from the company. Most of my patients don't want to shell that kind of money out for modest results. Contrave is Wellbutrin and naltrexone, and then Saxenda is a DNA component that acts like insulin. Okay, it's a high-dose Victoza. Victoza is very useful for the treatment of diabetes. A higher dose, and there was just a report in the American Medical Association, JAMA, yesterday, showing a reduction in weight with high-dose Saxenda. I personally don't prescribe it because it has a lot of effects, and I think it should be prescribed by an internist who specializes in obesity medicine or an endocrinologist, but those are available. By the way, these are injections, and they're not cheap, and you have to be on them long-term. And so the limitations is they're modest effect. There's side effects to it. Phentermine is amphetamine. If you stay on a stimulant, it's a cardiovascular stimulant. It raises your blood pressure. It increases your heart rate, stresses the heart. Anybody who has hypertension shouldn't take it. You can have a stroke with it. So those are the kind of side effects. The weight loss is usually temporary, and once you go off, most people experience a rebound weight gain up above where they were before. So those are kind of the limitations and why surgery came around.